pregnant is very important, especially if you're married. But to some ladies, it is something that is so tough to come by. Despite you looking like everything is okay. Hello, everyone. Thank you so much for tuning in on this episode of our discussion. Thank you so much for joining on this live discussion. I hope we all are going to enjoy this discussion together. And if you have a question, please you put in the comment section, put in the chat as we discuss. Thank you so much for being here. I'm your host, Tima Dauda, medical laboratory scientist and a reproductive health consultant at Tima Diagnostic Center. Thank you so much for being here. So we are going to answer this question: why you might menstruate but you find it difficult conceiving. So you menstruate every month, like every month you see your period, but you find it difficult conceiving. Why? So we are going to look at this and we'll try to give some answers to it. Please, as we move on, if you have any question, you put in the comment section. We'll try to answer you as early as possible, as soon as possible. Thank you so much for being here. Pregnancy starts with intercourse, then you have fertilization, then you have implantation, then you now carry the baby right up to 9 months, then you deliver the baby. Because generally what you might hear about infertility is when you have difficulties in conceiving as well as difficulties and you're carrying your baby right up to 9 months. If you are a lady, maybe you conceive, but you can't carry your baby right up to 9 months, then there is a probability that you have a fertility issue. That could be as a result of the fact that you have miscarriages constantly. And if you have constant miscarriages, it's part of your fertility. Sorry for that hitch. So if you carry your baby, if you get pregnant but you're unable to carry your baby right up to 9 months, then there is an issue with your fertility, which needs to be looked at and corrected. We are going to look at this particular question: why you might menstruate. A lot of ladies will say, oh, I menstruate, but why can I not conceive? I menstruate monthly, why can I not conceive? And we'll try to give some answers to this. And if you're a lady who have been going through difficulties, I pray that God make it easier for you, such that you can conceive and carry your own baby. I wish every lady good luck. And if you're a lady watching with difficulties conceiving, I wish you good luck as well. And I hope that this video will find a place to help you, assist you as you go on this journey. This journey is quite a challenging journey if you're trying to conceive, especially if you've tried and it's not going. It's quite challenging, but rest assure you that if you follow basic tips, basic steps, you're going to find it easier for you to conceive and you have your own baby. So thank you so much for joining us this morning. Now, if you're just clicking, please don't forget to also share this video out and subscribe to our channel. Check your health and maintain your health. When we talk about menstruation is a monthly bleeding of a lady, and you menstruate when an egg has not been fertilized, then you menstruate. So if an egg has not been fertilized, you menstruate. If an egg has not been fertilized, you menstruate. If an egg has not been fertilized, you menstruate. This menstruation, to some people, they see it monthly. To some people, they have very long menstruation because menstrual cycle in general differs from one person to another. There are people with very short cycle, such as 21-day cycle. So if your cycle is very short, like 21-day cycle, obviously you will menstruate like twice a month. Let me say you see your period on the 1st of January. If you have a 21-day cycle, you will still menstruate again in January. If you see a period on the 1st of February, if you have a 22-day cycle, you will still menstruate in that February. So menstruation differ from one person to another. People with very long menstrual cycle, their menstruation will probably come maybe after 1 month. That is, you have to finish that month because, let me say, your menstruation actually starts on the 1st of January and you are somebody with a 35-day cycle, then you will only see your menses in the next month. So with that said, there are a lot of reasons why you might have difficulties conceiving. And for you to menstruate, it doesn't mean that every other thing is okay because you're menstruating. For you, menstruating is a good thing, obviously, but it doesn't mean every other thing is just fine. There are actually 5 major factors that affect fertility. 5 major factors. These factors are timing, that's the right time to have intercourse for pregnancy to occur. Then we have age, that is, how old are you? Then we have your weight. So healthy weight is part of your fertility. It's not just that you're menstruating, or it's not just that you think that every other thing is okay. No, you have to have healthy weight. Then you have lifestyle and environmental factor is another factor that affects your fertility. After that, we now have health and medicals. So if you look at it, we have first one, which is timing, the right time to have intercourse. The next one, which is age. The next one, which is weight. Next one, which is lifestyle, environmental factors. And the last one, which is health and medicals. Please, 1 minute. Please, sorry. So there are 5 major factors that affect fertility, and we have timing, we have age, we have weight, we have lifestyle, and you have health and medicals. Now, all of these factors, if they are in shape, then the probability of you conceiving is right up there. You have about 80 to 90% probability for you to conceive. But if this timing has an issue, no matter how the other factors look like, it will be difficult for you to conceive. If age, let's say for example, you're 42, 43, I'm not saying you can't conceive at 42, 43, but the chances of you conceiving at 42, 43 is not that great as compared to someone who is 25, 26, 27. We come to weight, healthy weight. Healthy weight affects your fertility, and this is for both men and women. So if you have good weight, your sperm is good, you have quality sperm, as well as if you're a woman with good weight, you also have good egg. The quality of the egg is good, because if you're underweight, the quality of your egg is not that good. It will not be the best. If you're overweight, the quality of your egg will not be the best as well. 1 minute, please.
Thank you. I thought you not be there.
That you thought I will.
That you not be here now.
The first one you did it well. Put on your clipboard. Did you come on any strip from home? Do you still have any strip with you? It's your husband back.
I'll basically mark it as any pass.
My major problem was I was not even seeing the control line.
Yes. I rest for over 1 hour, but I don't see anything.
I was not seeing the control line.
Are you?
Yeah, I was like, I'm sure this other 3 ovulation tests you did, you you made an error with it. You didn't do it. You didn't do them well. It's true that the ovulation might have passed already. Look at this one. This is already controlling. But what you're showing me, I've not even seen
I
control.
don't know why it's bad. Oh, it's bad. No, the
They-
teacher is bad.
You're probably doing it the wrong side.
Then how
You-
does
you-
it the same way that for the first day?
I don't think so. I'm sure you're putting by this direction.
No, I'm putting my this direction.
Either you're pushing past the maximum mark. Now, if you look at this, look at this mark. Either maybe you're putting it right down, right up to this. So if you look at this, your filter window must have passed. Or according to what we calculated, Or supposed to, when were you supposed to ovulate?
I don't know that the last day will be like the third, but I don't know the exact day.
Okay, on the third. Okay, today is supposed to be the day how many of your fertile window?
Today is Thursday. No, today's Wednesday. Today is the third day.
Okay.
Because I started on Monday.
Actually, this is ovulation test kit. Although it's written ovulation predictor, but it's a test kit to do for ovulation. In this discussion, we are actually going to explain even with this ovulation test kit. For those who have never used it before, you will be encouraged to use it, to go get it and buy it so that you can use it. Go on with that.
I should buy it.
Mhm. So today's supposed to be day how many?
Third day.
Day 3 of your fertile window. Okay. But have you noticed anything like maybe discharges, any changes in your body? How's your discharge?
It's white.
Okay. Okay. And supposed to be fertile between. So he came when did he pack yesterday?
Yes, it came yesterday.
Then it's okay. Then it's 2 days. Today and tomorrow. You'll try.
Thank you.
Welcome.
That's good.
Just take it for your own view now. Yes. Snap. So we are looking at why you might menstruate, but you find it difficult to conceive. And I was actually showing ovulation test, which we are going to discuss about it as we move forward. So the very first thing I want us to understand is that you can actually menstruate, but you find it difficult conceiving because of many other reasons. Because the factors affecting fertility is not just one factor. There are many factors that affect fertility. There are actually 5 of them, and which I've made mention of them. That is timing, age, weight, lifestyle, environmental factor, and then health and medical. So those are the 5 major factors. So if all of these factors are put intact, I am pretty sure you will conceive. Yes, I'm pretty sure you will conceive. So I will encourage you, please, as you try, make sure that you look at all of these other factors. Yes, make sure that you look at all of these other factors. Don't just assume that, hey, come on, this is the only factor and that is all. Hello, sister. Spice it up. Welcome. Thank you so much. Not your name. Forgotten. No, it's okay. It's okay, sis. Welcome. Thank you so much. Thank you so much. So you might be menstruating at the same time you have maybe issues with your weight. You might be menstruating, thinking that no, because I menstruate, everything is okay. But at the same time, you have issue with your lifestyle and environmental factor. You might be menstruating and you think that everything is okay, whereas at the same time, you have issues with your health and the medical part. And this is where most of us ladies pay emphasis on when it has to do with the health and medical part. So we pay little attention to the timing, we pay little attention to our weight, we pay little attention to our lifestyle and environmental factor. We only look at health and medicals. We only look at the fact that, oh, come on, I can menstruate, I don't have chlamydia, I don't have gonorrhea, so I should conceive. Health and medical is just one part when it has to do with your fertility, just one factor. There are other factors. So if you menstruate monthly and you can't actually conceive, please do well to look at these factors. So I'm beginning with the first factor, which is timing. Timing. So timing is the very first factor. Thank you so much, sis. Thank you so much. Please, you can ask your questions here as we discuss. Yes, because it's about fertility in general. So timing is the very first factor that affects fertility. So if you actually menstruate, but you find it difficult to conceive, then look at timing. Are you sure you're having sex at the right time? And for those who have been here earlier, I actually opened ovulation test kits. This can actually help you with your timing. The ovulation test kit, it can actually help you with the timing. So if you menstruate regularly, that's every month, look at your timing. Are you having intercourse at the right time? What is the right time to have intercourse? Depending on your own menstrual cycle, the right time falls around the ovulation period, depending on your menstrual cycle. So for somebody who is a 28-day cycle, her own best time for her to conceive will be around day 14, which therefore means that day 12, day 13, day 14, day 15 will be good. In essence, we actually have 7 days for your fertile window, which you start from the day that you ovulate. You take 4 days before that day, plus the day of ovulation, and 2 days after ovulation. It gives you 7 days. These 7 days are the best days if you want to conceive. But even within this fertile window, there is the most important within the fertile window. So if you take somebody who is day 28, for example, who ovulates on the 14, the ovulation is the 14. Fertile window starts from 10, 11, 12, 13. Sorry, 11, 12, 13, 14. And then we have 15, 16, and 17. So you see that for somebody who is a 28-day cycle, the person ovulates on the 14. If it takes 4 days and 2 days after. But the most important will be the 2 days before your ovulation day, plus the ovulation day and the day after ovulation day. So if you're day 14, so we have the 13, we have the 12, we have the 13, we have the 14 and the 15. So 12, 13, 14, 15 will be your most important. But remember that the fertile window actually is made up of 10, 11, 12, 13, 14, 15, and 16. So depending on your cycle, your timing will depend on your cycle. So that's the more reason you all need to learn the menstrual cycle. You can always check the menstrual cycle on this channel. We have it on this channel. We've done many videos on the menstrual cycle. Please check on how you can calculate. But you can also send us a WhatsApp message on 0023766600610 or 7 for us to explain if you don't get it. So learn your menstrual cycle so that you know about timing. Ovulation, this one like this, ovulation test kit, this one can actually help you. Now, these are just simple test triplets. This can actually help you if you're trying to conceive. I don't know if it's visible. This is ovulation test. This can actually help you in terms of timing as well. So if you have been struggling with timing, make sure that you calculate your menstrual cycle very well. Then you get ovulation test kit. Run the test. Just get many of these test kits. Run the test. If you run your ovulation test and you see that you have a positive ovulation test, it doesn't mean that you're ovulating at that moment. It means that you will ovulate in a day or two. And a positive ovulation test does not mean that positive ovulation test does not mean that you just have 2 lines. Yes, Positive ovulation test doesn't mean that you just have 2 lines. Okay, you're asking how is it used? I will demonstrate it here. Let me just get a sample. I'll just get water and I'll demonstrate it with water. Yes, just give me 1 minute. So I will demonstrate how ovulation test is used and interpreted. Is my Now, for those who are just joining us, we are actually answering the question why you might menstruate every month, but you're having difficulties conceiving. So we have been saying that there are different factors that affect fertility. It's not just the fact that you're menstruating. Menstruation tells you that you were not pregnant and that many other things were fine. But for you to menstruate is not a guarantee that everything is all right. There are many other factors that affects fertility, and there are actually 5 major factors that affect fertility. So we started with timing as the first factor that affects fertility. So we started with timing, and I want to explain how you can use ovulation test kits in order for you to know the right time to have intercourse with your partner. How do you use it? Now, this is just a simple test strip that you dip in urine. We have other test strips which are much more advanced, and it is in a cassette light that you just drop and it goes. So I will be demonstrating with this such that it will help a lot of people. So this is like your simple pregnancy test. The ovulation test is like a simple pregnancy test. So you open the foil, you remove. Now, looking at this is, like I said, it's just a simple ovulation. It's just a simple test, just like the pregnancy test, please. So I don't know, it will be difficult. My camera is pretty full. I don't really know how. Okay, when you open your pregnancy test strip, you are going to see that they have written on it, there's a place they have written maximum on it. I'm sorry, it seems people have very difficult time saying this maximum here. So there's a place that have written maximum. That is the direction you dip in your urine. Yes, with ovulation and pregnancy is the same thing. The procedure is the same thing. So that's the direction you dip. Then you dip such that your urine does not cross the mark that is written in that maximum. So your urine should not cross that mark. Yes, I know you can't see. You can't see. That's what I'm trying to explain. Please, I'm sorry. You won't be able to see it because I'm really trying so that you put, but it seems it's not really clear. Yes. It's really not clear. It's really not clear. It's really not clear. But I'm just explaining that when you open your test strip, like a pregnancy test strip, there is a place that is written maximum on the test strip. Yes, it's written maximum on the test strip. This one is right here. I'm sure we can see the blue mark. I'm sure you can see the blue mark. So that place, that blue mark, that's where you have to put your urine. That's where your urine should end. It should not be more than that blue mark. Now you are dipping the direction where you have that maximum into the urine. But make sure that you don't pass that blue mark that's been indicated maximum on it. Yes. The urine sample should end. The truth is that if you dip more than that, you might not have the desired result. The result might be 40. Yes, you might have wrong result. So when you dip in urine, I'm just dipping. This is water. I'm just considering it to be urine. So when you dip, it's going to migrate just like pregnancy test. In short, this is pregnancy that you do. Just say that you're doing pregnancy test, bird. The interpretation will be different. So when you dip, it's going to migrate. It's going to come out. I'm sorry, my camera is really, really bad there. I'm sorry. Yes, but please, the explanation is, I'm doing detailed explanation so that I will understand better. So when you dip, it's going to migrate. That's the liquid from here. I'm considering this water is urine. So the urine going to migrate and climb right up here. I'm sure you're seeing what I'm holding, because people might go now and they are holding the part where they have to put inside urine and are dipping the opposite side. Please make sure that when you open, you look at where they have written maximum. For pregnancy is the same. That is where you dip in your urine. So look at where I'm holding. So when you dip, it's going to migrate. You are expecting to see at least a line. With ovulation tests, you are expecting to see 2 lines. Whether you are ovulating or not, whether you're about to ovulate or not, whether the test is negative or not, we are expecting to see 2 lines with ovulation tests. But I'm saying that word. There are times that you might have maybe a clear negative test where you have just a line, but you should see a line. You must see a line, please. If you don't see any line in that window, in the window between where you drop and where you're holding, if you don't see any line in that window, I'm sorry, you need to discard that particular strip. There is an issue with the strip, or your method was completely wrong. So when you see a line, what does it mean? Let me say you see just one line, then that test is completely negative. Just forget about that test. If you see just one line, the test is negative. It's telling you that either your ovulation is far-fetched or you're just from ovulating. Yes. So maybe you just ovulated or is far-fetched. So if you see just a line, that line should be the control line. And how will you know that it is the control line? The control line normally is closest to where you're holding the strip. And this principle is the same with pregnancy test place. The issue is with the interpretation of this one. The control line is nearer where you're holding. If you see 2 lines, the line furthest away from where you're holding, from the direction you're holding, that line is the test line. And the line closest to where you're holding is the test line, is the control line. So we have the test line furthest away from where you're holding, and the control line nearer to where you're holding. Now, if you see 2 lines, does it mean your ovulation test is positive? The answer is no. What you need to look for are those 2 lines the same intensity. So is that first line, that's the line that is furthest away from where you're holding, the line that is this way, is the line equal to the line closest to your hand? If it is equal, then you can actually see that ovulation test is positive. But if that line, the line furthest away from where you're holding, that's the test line, if the line is thinner, is lighter than your control line, the control line is always there. So if that line for it is lighter than the control line, remember I said the control line is nearer to where you're holding, then that test is negative. Now, if the test is positive, what does it mean? So if that test is positive, it is telling you that you will ovulate in a day or two. It is not telling you that you are ovulating at the moment. Because that's another mistake that we do. We think that if the test is positive, it therefore means we are ovulating at the moment. No. So that test guides you towards timing. Remember, we are still discussing timing, which is just one factor of fertility. So that test guides you to tell you that, hey, if you do the test today and the test is positive, it means you will ovulate within 24 hours or 48 hours. Which therefore means that what? If you are somebody who is a 28-day cycle, you do it today, then today is probably around your day 13, or today is your day 12. Which therefore means you ovulate into 1 day or 2 days' time. That particular day you have a positive test is a very good day to meet with your husband, because sperm cell will wait for the egg cell on that day 14. But if you want something like maybe a baby boy, then you might wait right up to that day 14, then you have intercourse with your husband. I hope this is clear. Please, if you have any issue, please, about this, before we go to the next point, which is age, let me know, please. If you have any question about ovulation test, let me know. Ovulation test is tricky, please. It's not a straightforward thing, even though, like I said, it is the same like pregnancy test. Your ovulation test is pregnancy test in the sense that the sample I use is urine, just like pregnancy. And the way we do the test, just like pregnancy, the issue is with the interpretation of ovulation test. So if you're d'accord with that, then we'll go to the next. So that's the very first factor. So if you have been trying to conceive and maybe you menstruate and you think that everything is okay, please, it might be that you are having sex at the wrong time. So like I said, timing depends on your menstrual cycle, and using ovulation tests like what we have just explained can guide you so that you know that, hey, having sex at this time is the best. The next factor which you should look at is your weight, is your age. How old are you? Fertility decreases with age. Why? Because as a woman ages, all right, she actually ages with her eggs. A woman is actually born with all of the eggs that God ever gave her. So if you're 20 years, your eggs 20 years. If you're 30 years, your eggs are 30 years. If you're 40 years, your eggs are 40 years. If you're 25 years, your eggs are for 25 years. And so on. So as you were born, if God say, Madame Pascaline, you're going to have potential 1,000 children, so God will give you 1,000 eggs. But remember, this egg, there are many eggs that will not also be okay. Yes, it's not like if you have 1,000 eggs, all of those eggs are good. No, you might have that 1,000 egg, and within the 1,000, maybe you have about 500 that are okay. Yeah, maybe you have about 500 that are okay. And if you have about 500 that are okay, and let's say you are 45, for example. If you're 45 and you have about 500 eggs that are okay, within this 500, remember that your age and your eggs are the same. So this is going to affect them as well. Yes, this is going to affect them as well. So the key here is, if you are already more than 40, I will advise that make sure that you put your dieting should be your key. Do a lot of exercises, eat a lot of vegetables and fruits as you try. Do a lot of exercises, not vigorous exercises, but constant exercises. Yes, such that it rebuilds this system of yours. And then you follow up with fertility supplements. in order to supplement what you have. So if your dieting is good, then that age factor can be minimized. But if you're a young person, obviously you should not be having any issue with your age. The next factor that might be affecting you without you knowing, but because you think that all the other things are okay, you think that if you menstruate monthly, everything is okay. The next factor is weight. Weight. Weight here, we're talking about healthy weight. And for you to know your healthy weight, you need to measure your BMI, your body mass index. Measure your BMI, and if your BMI, pardon, welcome. If your BMI is, let's say, if your BMI is between 18 to 25, then you are normal, your weight is okay. But if your BMI is below 18, then you're underweight. If your BMI is above 25, right up to 30, then you're actually overweight. If your BMI is above 30, then you're obese. How do you calculate your BMI? Your BMI, which is the body mass index, is calculated by taking your weight over the square of your height. Your weight over the square of your height. So let's say you weigh 100 kilograms and your height is 2 meters. So a square, it's something by itself. So you first of all, you take your height, you square that height. That's multiply that height times itself. That's a square. 10 square means 10 times 10. 3 square means 3 times 3. 4 square means 4 times 4. So 2 square will mean 2 times 2, which therefore means if your height is 2 meters, your the square of 2 will be 2 times 2, which will be 4 meters. Now you take the weight. What is the weight? We have assumed that the weight is 100 kilograms. So 100 now divided by 4. What are you going to have? You're going to have 25. In this particular case, you see that word. This person will just be okay because above 25, the person will be overweight. But now this person is not overweight because the person is extremely tall. I doubt how many ladies will be equals to 2 meters. So, so you need to take that into consideration. This person is almost the same. It's almost like the weight is just almost okay because the person is extremely tall, 2 meters. Then if you do it's above 30, you are obese. So with that, you know that you have healthy weight. Please, weight affects both male and female. It affects the egg of women and also affect the sperm of men. I think this is also understood. The next factor that can affect you without you knowing, maybe because you're looking at the fact that you menstruate monthly, you just think that everything is okay, is lifestyle and environmental factor. What do you eat? What do you drink? What do you smoke? If you're a smoker, the best way to stop. Please, we don't negotiate smoking when it has to do with fertility. Stop it. Because this will affect sperm cell, affect egg cell. If you drink a lot, please reduce it to the barest minimum. What do you eat? Obviously, like I mentioned earlier, vegetables, fruits should be your watchword. And the lifestyle. Do you do regular exercises? If you don't, then you have to. Do you take caffeine? You drop it. So all of these are things that you need to look at. And the last factor, which is what most people are aware of, is health and medicals. So you look at your STIs, you look at your hormones, you look at your structures. So STIs will be chlamydia, gonorrhea, syphilis, and all the like. Then you look at the hormones. The hormones here, we are talking about follicle stimulating hormone, we are talking about luteinizing hormone, we are talking about prolactin hormone, talking about TSH hormone. All of those hormones, look at them. And then talk about the structural, that has to do with your egg, your womb, That is your ovaries, your womb. Your womb, that's your uterus. So you look at your fallopian tubes, your ovaries, and your uterus. All of that need to be checked to see if they are all okay. With that, you will see that maybe even though you menstruate monthly, you might have an issue with this, and this has been the cause why you have been having difficulties conceiving. So please go home and try to put this in practice. I am pretty sure this is going to help you, and you'll come here to testify with a bouncing baby boy or baby girl. Why not twins? So thank you so much for being there. Sis, please, if you have any question, just go ahead. So I will wrap up in 3 minutes, please. If you have any question, please, you go ahead. So for all those who will be joining us, please don't forget to share this video. Don't forget to also invite your friends to watch this video. I know from the start it might look boring because I was somehow occupied doing one or two things, but you are going to enjoy a lot when you actually watch the video completely. So we have been looking at the fact that you might menstruate, but you have an issue with your fertility. Why? So we have been trying to explain this by saying that what, even though you menstruate monthly, it is still possible that you have issues with your fertility. And what are those issues? So we're looking at these factors, that there are actually 5 major factors, one being timing, one being age, another being weight, that's healthy weight, another being lifestyle, environmental factors, another being health and medicals. So we have been looking at all of these such that if you put all this together, you're going to have a good fertility. And we also explain about ovulation test and how you can use it. This video is very rich. Please do wait to go through it completely. Sis, I'm sorry that your question came and I don't know, YouTube is just making the thing a type. The thing is just popping up and going. Can you please just repeat the question? The question came and it lasted just about 10 seconds. YouTube does not allow us to see. I don't know. Some message. Please, you're asking a question, please. Okay. What could stop menstruation even before menopause? When you say stop, please, what do you mean by stop completely? You don't menstruate completely? Is that a question? It's possible for you to have intermittent menses, meaning your menstruation, maybe you have delayed menses, but if you're saying stop, you're saying stop completely. Now, whether it is stopping completely or whatsoever, menstruation has a vital role to play with your fertility, obviously. That's why we're saying that somebody may menstruate monthly and the person thinks that everything is okay, whereas everything is not okay. The menstruation deals directly with your hormones. Menstruation deals directly with your hormones and your ovaries, obviously. So if you have issue with your menstruation, then your ovaries and your hormones have to be checked. That can better be assessed by your doctor. So if you visit your doctor, I am pretty sure that your ovaries will be looked at after an ultrasound has been done. Your ovaries will be looked at to see if there are any issues with your ovaries, and then your hormones as well. Remember, follicle stimulating hormone is that hormone that stimulates an egg to be released. So if, let's say, that egg is not even released, then there is a possibility that you might have an issue with your menstruating. Yeah, there's no problem. Talk on WhatsApp. Thank you so much for being here. May God bless you richly. Please, for all those who will be joining us later, don't forget to send us a WhatsApp message through 002376660061007. Thank you so much. Don't forget to share this also to 1 or 2 people who might need it. There are a lot of people out there who might need this detailed explanation and they might not get it. So just share to them, even share on your WhatsApp groups and status as well. This is going to help a lot of people. May God bless you. Do have a wonderful time. Please stay safe.